We are here with Professor Doctor Erkan Kaptanoğlu, and today we are going to ask him many questions that come to our minds. But first of all, Doctor, can we get to know you?
Hello, I'm Professor Doctor Erkan Kaptanoğlu. I specialize in neurosurgery. Of course we do surgery. Therefore, brain surgeries, spine surgeries, nerve surgeries in the arms and legs, which we call peripheral nerves. I am from Balıkesir. I did my specialization in Ankara. After graduating from Cerrahpaşa, I went to the Faculty of Medicine at Numun Hospital, Ankara Numun Hospital. Then I became a doctor at Hacettepe, a postdoc at the University of Toronto, Canada. Then I became an associate professor. Studies, surgeries, research. This is how we have come to this day.
Thank you very much, Doctor, for introducing yourself. Now let's start with the questions we have. What exactly disc, which is on everyone's mind? Can you give us an explanation?
Lumbar disc herniation. First, let me briefly explain the anatomy. Here, this is a model of the waist. Underneath is a model of our pelvis. There are 5 vertebrae in our waist, and between these vertebrae there are cartilage pads. On the back, this is the skin of our back, and here is the canal where the spinal cord is. The spinal cord ends here. Then it goes down in the form of nerve fibers, and these nerves come out from the sides. After exiting from the sides, they go to our feet, legs, and the tissues around our pelvis under different names. When this cartilage breaks down and tears and compresses these nerves, we call this a herniated disc.
Okay, Doctor, thank you very much. Doctor, what are the symptoms of a herniated disc? How is it diagnosed?
Lumbar disc herniation is a disease of the cartilage between the bones in our waist. When the cartilage itself deteriorates, it causes low back pain. Apart from that, if it compresses the nerves that leave the waist and go to the leg, then it causes some symptoms in the leg. The most important of these symptoms is loss of strength, loss of power, or paralysis. The other is pain. The other is loss of sensation, loss of feeling. In other words, loss of sense of touch. The other is loss of reflexes. We can understand this on examination.
Okay, Doctor, thank you. Doctor, how is the treatment of a herniated disc? Is there a complete treatment?
Of course, we look at herniated discs from the surgical side. But a significant number of patients are not operable, not surgical. Physical therapy can be done for those patients. Algologic treatment can be done. Algologic treatment is pain treatment. Various injections, dry needles, medicated injections can be given here. The patient can do bed rest, they can use a corset. There are different physical therapy methods, they can be applied. It can be treated in this way. If it does not go away with these treatments, and there is a large herniated disc and it severely compresses the nerve, then we talk about surgical methods.
Thank you, Doctor. When I was diagnosed with a herniated disc, they told me to do a physical therapy procedure. But of course it is a waste of time sometimes. Doctor, now about the neck. What exactly is a cervical hernia?
A cervical hernia is actually a tearing of the cartilage between the bones of the neck and its displacement towards the nerves.
Okay, Doctor, thank you. So what are the symptoms of neck hernia?
In a cervical herniated disc, when the cartilage here comes towards the back, it either crushes the nerves coming out from the side, or crushes the spinal cord, which is the extension of the brain just behind the bones at the back. Different symptoms occur according to the two. If it crushes the nerve, there is a problem with the nerve going to the arm, like pain, numbness, loss of strength. If it crushes the spinal cord, there may be problems in all functions below the level of the crush. So what again? Loss of strength, loss of sensation, reflexes?
Doctor, can it lead to paralysis of the arm?
Yes, it can cause paralysis of the arm, because it can crush important nerves going to the arm. If it crushes, the patient may not be able to lift the arm or pull something she is holding. In fact, at the level of which nerve the cartilage crushes that nerve, it gives symptoms accordingly. If the cartilage between the 5th and 6th honors crushes the nerve coming out of there, this arm muscle, which we call biceps, cannot perform this elbow flexion movement. If there is a problem with the lower nerve, it cannot perform the pushing movement. In other words, The symptom will be different depending on the location of the disease.
So, doctor, what exactly are the triggers here? I mean, is it because the person made a wrong move? Carrying something heavy? What can trigger it here?
Now, these are actually degenerative spine diseases. In other words, these are diseases that occur as a result of the wear and tear of the cartilage due to years of use. Rarely, after falls and traffic accidents, we see that the cartilage between the spine tears and comes towards the nerves with the great movements of the spine.
Thank you very much, doctor. And how can you treat a herniated disc in the neck?
Cervical herniated discs, lumbar herniated discs, and back herniated discs are all treated with non-surgical treatment methods, which we call conservative treatment, and most of them recover with this. These include treatments such as physical therapy, algological treatment, corset applications, bed rest.
Okay, doctor. Thank you very much.
You're welcome.
Well, doctor, if this does not pass with physical therapy, what kind of treatment process do you apply?
Now, if the patients have severe pain, because sometimes it can cause incredibly severe pain. If there is a serious loss of strength, loss of sensation in the neck, and if there is a severe compression of the nerve suitable for that region in imaging such as MR tomography, then our patients need to be operated. In surgery, we remove that piece of cartilage and replace it with a small prosthesis. This prosthesis can be movable or immobile. We usually operate from the front side. Rarely we operate from the back. We treat according to the condition of the patient and the cartilage and hernia.
So, doctor, are these surgeries heavy surgeries? How many hours can they take on average?
Not these surgeries, actually. I always tell our patients that cervical hernia surgery is one of our most satisfied surgeries. If you remove that piece of cartilage in exactly the right place, and the patient's complaint is very high, the patients recover very quickly. But they are important surgeries. Because as you can see here, there is one of the vessels feeding the brain on one side of this cartilage. Right behind it is the spinal cord. On the other side is the nerve going to the arm. It is an important area. It's a very important area. But technically, these are surgeries where our patient satisfaction is high. Very high patient satisfaction. An hour and a half is the same with a herniated disc. It takes that long.